Thank you. Good afternoon, and welcome to the beautiful town of Colden as we are here to officially kick off the opening of Erie County's new ambulance service. I'm County Executive Mark Polenkars, and I'm joined here today by Lee with Deaf Access Services, who'll be providing the American Sign Language for those who may be watching at home. And we have a lot of folks here, as you can see. I want to thank all of them for being here because this was a community effort to create this new ambulance service. But I specifically want to note a few individuals who played a role through the years and also are with us here today to create what is the first ambulance service in the history of Erie County government. First off, we're joined by the Colden Supervisor and First Assistant Chief, James DePasquale, who you'll hear from very soon. Jim was actually one of the people that we talked to initially when we heard about the issues with regards to the lack of ambulance service in the south towns of Erie County. And I want to thank him and the members from the Colden Fire District that are here today. You will also hear from Erie County Department of Health Commissioner Gail Burstein, as well as the Deputy Commissioner who's in charge of the Department of Health's Emergency Medical Services Division, Greg Gill. I thank them for being here. We are joined by a number of local officials, many of whom were instrumental in discussing this and making certain that we got this passed very quickly. I want to thank our supervisors. There are other supervisors here. We have from the town of Boston, Supervisor Jason Ketting. Thank you, Jason, for being here. From the town of Concord, Supervisor Phil Droz. I want to thank Supervisor Droz for being here. From the town of Holland, Supervisor Jeff Hack. Thank you, Supervisor Hack, for being here. And from the town of Collins, Supervisor Ken Martin. Thank you for being here as well. We also have board members from various communities. From the Colden board, we have Patricia Zerbrick and Dennis Robinson. From the town of Wales, Wales is represented by board member Brenda O'Connor. And from the Aurora board, we have Joe McCann and Luke Wachensky. So I thank each and every one of you. And as you can see, with the support that we have from across the community, this is truly one of the ultimate nonpartisan issues I've ever dealt with in county government. This was an issue that needed to be resolved, which is the lack of quick and reliable ambulance service for many of the communities of Erie County. If you live in the city of Buffalo, if you live in some of the inner ring suburbs, if you call and need an ambulance service, it is there very quickly. But if you do that in some of our more rural communities, especially in the south towns of Erie County and here in ski country, you can wait a long time before an ambulance shows. Now, the volunteer fire service does an incredible job of responding to these initial calls. The problem is at times, because of the injuries that have been suffered or the illness that the person has, a higher level of service is needed. And that's why you need to have trained paramedics and EMTs with a fully stocked ambulance available so that these individuals could be rushed to a hospital or needed area. And unfortunately, for a long time, that has not been the case here in Erie County, where sadly, because of whatever the reason, some private ambulance companies did not want to offer coverage in this region. But today, we're here to tell the people of Erie County the first of Erie County's emergency medical services ambulance fleet is here. It is on duty. It will be starting, and it will be the first of 5 that you will see over the next few months with a brand new team of paramedics, EMTs, and other which will be assisting and contributing to ensure the safety of our community. It's as simple as that. This project began as an idea through a conversation that I had with a number of the supervisors from the southern part of Erie County, including, he's not here, but I do want to note, Supervisor John Tobiah of North Collins, as well as former supervisor of the town of Eden, Missy Hartman, Jim DePasquale, and others who said, Mark, this is something that needs to be addressed. These towns could not do it on their own because it is a very expensive venture. It is not something that's easy to do. But we worked with our partners in government to figure out a way to make it happen. So I'm proud to say that we are officially dedicating our brand new Erie County Emergency Medical Service ambulance service today. We have secured 2 ambulances and 2 fly cars. As I noted, we're going to have 5 ambulances in total, 3 additional ambulances on the way. These ambulances will be outfitted with light-saving technology as well as including utilizing current LifePak monitors for cardiac monitoring, blood pressure monitoring, cardiac defibrillation, and measuring the amount of oxygen in the blood. And I want to thank the town of Colden and the Colden Fire District, because the first location that we're placing an ambulance is here, right in the center of what really is south central Erie County. It will be a base not only for ambulance operations, but a state-of-the-art EMS training will be created at our new full-time facility that we are in the process of building in the town of Aurora. Officially, there are requests for proposals that are going out on that right now. We do expect that within the next couple of years, we will have that new facility up. But we knew there was a need that needed to be met immediately, and that's why I want to thank the town of Colden and the town of Colden Fire District for helping us by offering this location as a base of operations. I also want to note here, I just looked at them and I didn't have them on my sheet, but I should have not forgotten. We also have our Commissioner of the Department of Emergency Services and Homeland Security, Dan Neverth, as well as Deputy Commissioners Greg Butcher and Chris Coel. Chris, who's in charge of our Fire Safety Division, so I thank them for joining us as well. This just goes to show, by standing here today, the united effort we have. We came up with this idea in the last year after the conversations that we've had. I announced it in April at the state of the county, saying this is something that needs to get done and needs to get done as quickly as possible. Lo and behold, here we are in September, just a few months later. Not only do we have our first ambulance, we have our first crews in place, we have the relationships that exist with the town of Colden and with other towns to ensure coverage for our citizens. I don't truthfully know of anything in Erie County government that's moved this fast. And it just goes to show the bipartisan nature and, as I said, nonpartisan nature. Because what we're talking about is public safety. The top priority of Erie County government is to ensure the health and safety of our citizens. We've seen that in so many times over, whether it's snowstorms or the COVID-19 pandemic, or assisting our fire districts in the services that they need, and in this situation, ensuring that there was adequate ambulance service so that people would not die or suffer much more serious injury because an ambulance was not available for many, many minutes. And we're talking sometimes 45 minutes to an hour or more before an ambulance could come on site. This will go a long way to ensuring that when tragedy strikes, the people of Erie County are protected by having this ambulance service in place. It's taken a tremendous team effort to get to this point. I once again want to thank the supervisors that are here. I also want to thank our members of the Erie County Legislature who passed this in the early part of the spring. It was a big ask. It was millions of dollars is going to be invested in this ambulance service, not only with its operations, but in the building of the new facility. But everyone understands the need. There was no question in the long run. There's always questions about how you're going to pay for it, where's the money going to come from, but there was no question in regards to actually, is the service needed? Across the board, Democrats and Republicans were like, yes, the service is needed. Independents, yes, the service is needed. As I say, this is the ultimate nonpartisan issue because everyone understood that we needed to do this to ensure the life and safety of our citizens. I want to give a shout out to two individuals who've been intimately involved in the creation of this ambulance service. And that's our Deputy Commissioner, Greg Gill, from Emergency Medical Services in the Department of Health, and his Special Assistant, Missy Calhoun, working with Dr. Burstein. They've spent a lot of hours putting together a service that just a few months ago did not exist. This is a service that's going to save lives. And to each and every one of the individuals who's going to play a role, including the newest members of the Erie County family, the members of our Emergency Medical Service Ambulance Corps, I want to thank you for taking on this service. I want to thank you for taking on this effort. As a result, there are citizens in our community who will, and previously would have been at risk for dying due to the failure of an ambulance to be able to respond in time, that will survive and lead productive, happy lives because this ambulance service will be in place. So to all my partners in government, thank you. Thank you to the legislature for approving this. Thank you to the towns for supporting this. This is an example of what can happen when governments come together, when communities come together to create a better, safer, healthier community for all. And I'm very proud to be here today to note that with this announcement, Erie County now has an ambulance service that will help protect the life of individuals in our community, and we will all be better for it. Thank you, and it's now my pleasure to introduce to the podium the supervisor of the town of Colden, as well as the first assistant chief for the Colden Fire District, Jim DePasquale.
Thank you. Thank you, and welcome to Colden. This great community has been in need of more help as a volunteer agency. Our company is down to 4 basic EMTs. Now, we've always used paid service to come out of Springville as a mutual aid, and if they're with their availability and with the availability of the county, the residents of Colden will have, and the residents of the south towns will have that added security of knowing they have help coming. So I'd just like to thank the county for moving forward with this. I know the county executive and I, like he said, have talked about it. Many times supervisors and my town board have talked about it with the need for that extended coverage. And like he said, the county came through quick and they came through for real. So I'm happy to have them housed in Colden as our fire company is. And I thank everybody here for coming out today. So thank you very much.
Thank you, Jim. And as it was noted, this is truly a community-wide effort. Took a lot of effort to get here, and it took a tremendous amount of work from our Department of Health, which is the overseeing agency. The Department of Health has a number of subdivisions, including the Division of Emergency Medical Services, and they will be ultimately responsible for the provision of this service. And it is my pleasure to introduce someone that we all have gotten to know through the years, someone who's always advocating for the health and wellness and welfare of our citizens, Commissioner Dr. Gail Burstein.
Thank you. Thank you, County Executive. And I'm so privileged to be here today to celebrate with everybody the start of our ambulance service business to really help those individuals that are so far away from kind of the main drag of the ambulance business. So I've been very privileged to watch our Deputy Commissioner of EMS, Greg Gill, and his team take a vision of an emergency medical transport and make it a reality today. So each decision point, from staffing to the design of our new ambulances, has had a thoughtful, extensive input from Greg and his team. Quality, responsive pre-hospital medical care is an important step to make sure people who suffer from a serious injury or acute illness attain the best possible outcomes. And this service is a safety net for that critical emergency response, especially during peak call volume hours when special events exhaust local EMS resources. So we are counting down to Monday morning when our ambulance team will stand by, ready to respond to all calls. So thank you.
Thank you, Commissioner. As noted, this is a team effort by the Department of Health. Many people are involved, but an individual who was intimately involved was our Deputy Commissioner, Greg Gill. We are not here today without the effort and time that him and his staff put in to ensure that we could have this ambulance service. And it's now my pleasure to introduce to the podium our Deputy Commissioner of the Department of Health in charge for emergency medical services and now this new ambulance service, Gregory Gill.
Thank you, County Executive. I appreciate the opportunity to address the group here, and I've heard my name a couple of times, and I'm kind of impressed. But what you need to know is it's not me. My name is on it. I have a team. It's put in my notes as a team. It is a team that all came together in a short period of time, whether it's county executive, the staff, down to our newly hired paramedics and EMTs, that are all committed to bring the best care to the community. So how's this going to work? Great question. We're here as a supplement to what already exists. There's a tremendous network of volunteers. There's a tremendous network of commercial services, of first aid squads that are out there right now. But there are times they need help. The community's getting older. The community's living longer. There's more need for ambulance services. There's specialized hospitals to take patients to that we have to go further to get them to, where the ambulances are out of service for a longer period of time. We need to fill that gap when those ambulances are busy, when they can't be staffed. We used to be a three employment time where people work days, nights, and evenings. Now we're pretty much just daytime. So that leaves a void during the day for supplemental services, for ambulance services to be available. We want to fill that void. So how does it work? Nothing changes to the providers. Nothing changes to the community. They call 911. The 911 calls go to their PSAP, which is our fancy name for dispatch center. The calls are dispatched just as they are today. The primary response area gets the opportunity to go to the call. If there's some staffing issues, they go to their mutual aid company, which is a surrounding contiguous service that's around the area. If they're not available, then you have the opportunity to call our dispatcher, let them know what ambulances, what services we have available, where they are, and what their ETA, their calls are. It's something that we all want to work together. There's no direct calling for the ambulance. It has to go through the local PSAP and then be triaged and then sent through. We're here to help. And as time goes on, we'll develop the program. We'll hopefully have more areas to be able to staff ambulances and position ambulances. But that's our primary thing, is to be that safety net at a time when the system is stressed beyond its ability to respond, so we can provide more services. And you just think about it. This is a great day here in Western New York, nice and sunny. We have tourists that come in, takes our population, 950,000, and ups it. We have 219 that goes through, the thruway that goes through. We have a major airport. We hope that no disaster ever happens, but if it does, we have additional resources to respond. That is it.
Okay.
I'll give it back to the county executive.
Thanks, Greg. Thank you, Greg. This is just an example of what government can do by working together to create a better, healthier, safer community for all. And I want to thank each and every one of the partners who made this a reality. It moved very quickly. It moved quickly because everyone knew this had to happen. It needed to occur. And we're very proud to be here today. And with that, I'll open up to any on-topic questions. David.
Yes, sir. Originally, you had projected when we did the story in April, startup costs of just under $5 million and $2 million to maintain it. Have we pretty much held to that once you've got now that you've hired some people and bought some rigs?
My understanding is yes, we're right on that budgeted amount. Over time, we'll see what happens. One of the things that we're not doing today is I'd like all the new members of the EMS ambulance crew to raise their hand. Okay, we have a few of them here, and thank them, thank you. But we want to ensure, thank you. We want to ensure we have proper numbers. So we know we have what will be proper numbers for the initial rollout. We want to wait and see, do we need to have additional EMTs and paramedics over time when we have the full complement of 5 ambulances in service. We're not at that point yet, so we have what we think is appropriate for the immediate future, and we're going to review it to ensure in the future, if the cost does need to go up, what it is, and then of course go back to the legislature for approval.
Okay, well, on that note, I am curious to know how many you have and what they're paid, and is it commensurate to what they might make, or do you offer better salary and benefits in order to attract these?
We offer better salary and benefits than availables in the private sector substantially. I believe every one of the individuals who's a new member of the ambulance service came from the private sector. I will leave it up to Mr. Gill to talk about how many people have been hired at this point, and then the salary and that information we can provide to you later today. That was all approved as part of the budget process with the legislature a few months ago. Greg, you want to talk about the numbers and how they're going to be positioned?
Again, what we're looking at doing is increasing the staff as call demands. We didn't want to put too many people on and not have work for them to do. So what we've done is we currently have 8 paramedics, 2 of which are an administrative director and a supervisor, which are available to run to the field. And then we have 2 advanced EMTs. So we feel that's enough to start off the program and start applying peak time coverage throughout the week. And then once we see where the call volume starts to come from, then we can adjust after that. We have budgeted for more people in the future if we need them. It takes about 2 weeks for them to onboard, between interviews, between testing, between evaluations and stuff like that. So we have about a 2-week lag before we can get them up and going.
Well, Greg, if this is, as I understand it, you can't call this ambulance. It's dispatched if these guys can't get to it, then these guys go in. So if it's sitting here waiting, will they be kept busy enough, I guess, is the short answer here?
It's not busy. We have things for them to do. They're paramedics, they're advanced EMTs, they're EMTs. They know about healthcare, they know about first aid. Our plans, when they're downtime, our plans are to go to senior centers, talk to them about healthcare. Where our plans are to go to schools and talk to the kids about futures in pre-hospital care. We have a lot of things lined up for them. The benefit that we have being in the health department is we're also healthcare providers, not just in an emergency sense, but in an everyday sense. And what we have at Erie County, at the county executive's direction, back when the COVID times was started, I'm sorry to bring up COVID, all right? What we did do is we filed for our agency to be community paramedics. That gave them extra skills that they could practice out in the field during times of stress. We're still a community paramedic program. So if we need to go out and do vaccines, if we need to go out and do health checks, there's plenty of things for them to do. I'm sorry.
So on dispatch, when you were explaining the calls, if you said the primary response can't be reached, it then goes right to you. Is that all Erie County?
No. The primary response goes to the who has the jurisdiction of the area.
Here's the response area.
If they're not able to respond, then they go to their first mutual aid, which is usually a contiguous service around. If they're not available, then we'll step in. We don't want to disrupt what's currently happening right now. Did I mention the nurse navigator?
The one thing I want to talk about with David walked away, but we also have the ability to seek reimbursement from health insurers. So this in itself will be a revenue generator. I'm not exactly certain if it's going to be revenue neutral, but we can generate revenue from this through health insurers.
Also, your insurance, if you end up in one of these, your insurance covers you?
Yes. We actually collect on insurance for quite a number of individuals in county government that are using our services. It's not the first time that's happened, and it's something we'll be doing. We'll be billing through the billing department that already exists in county government. Any other on-topic questions? I'll go to you then. I'll leave it up to them. I'm not certain.
At this time, we're now looking to get into routine transports. Our goal here is to be there, that safety net at a time of emergency. So if somebody's under medical care, being taken care of, we'll work it through the system on how they normally get transported.
So out here, obviously, there's a lot of snow prep and whatnot, and looking into the overall county's prep as we go into, for instance, what we learned from Blizzard, longer driveways, longer areas. Has that been a struggle here in Colden compared to showing up to a duplex in the city? And are these new ambulance services equipped with more technology for that?
Well, the ambulance is equipped with the latest technology. I'll leave it up to the supervisor or the other supervisors to talk about what it's like sometimes here in the winter. Ironically, though, in our blizzard situation, it wasn't that bad in the southern part of Erie County. Some of those same supervisors were calling me complaining because we have a state of emergency and driving ban in their communities, and it wasn't that bad. Primarily, we were trying to keep people from driving into the urban and metro region where it was horrible. But yeah, I mean, that's definitely a concern because we know that this is the snow belt of Erie County. This location we're at right now gets some of the highest amounts of snow of any location in Erie County, but it doesn't matter. If somebody is in need, the ambulance has to respond, just like the volunteer firefighters respond. They're used to dealing with that. I don't know, Supervisor, you want to talk a little bit about the response in this area?
One positive note is Colden's ambulance is four-wheel drive, so we'll pull them out if we need to. But, no, but one of the greatest things that we pride ourselves in Colden is we do everything we can to take care of the community and to take care of the residents. So a couple of years back, the Colden Town Board got together with the highway superintendent and with our EMS chief, our former EMS chief, and we set it in process. So if there is a storm in the town of Colden, there's a 1-ton truck that comes from the highway department to this parking lot, and it leads our ambulance to where the call is, and it'll do anything it has to get us to a hospital. So the only thing is it wasn't available that during the blizzard, and our ambulance got stuck at the command center for 18 hours. But we do have that, and I saw it work firsthand, and it does work very well, and we'll continue to do that. And it's not just for us, but anytime a Colden resident has a problem, we're going to be there to help them.
As a first responder, what was that like to not?
I'm going to go to Mara. I'm going to go to Mara. She has asked a question.
Yeah, really quick. Jim, so on that note, the strain that you guys might
it's a peace of mind as an assistant chief when we get to a scene and I don't know what EMS is going to show up. That's heart-wrenching, especially for a supervisor or just a community member. So therefore now we're going to have the availability to get that care to the person in a more expedited manner and to know that we have help behind us. It won't change our direction of what we do, like Greg said, but it is a fail-safe for us so they can continue. They're allowing the volunteers to survive because the volunteer organizations, they need help. We need our members of our town residents to look and say, do I have a few hours to help out another town resident? And it's a great family, and it's very rewarding when we answer a call and I walk away knowing I might not have known the person, but we just helped them in their time of need. So this is just an added benefit that the county's given us the opportunity for.
Any other questions on topic?
How'd you pick the colors?
I didn't. I didn't. Team did.
Who did?
Our public health team.
Sure.
You, Greg.
Well, it's very self-serving. Oh, I'm sorry. In case you haven't told by the mumble and the accent, I'm from Long Island. And in Long Island, I come from Hicksville, and Nassau County Police were orange and blue. Oh, yeah. And I've always, you've got to retread here. I always wanted to get a job at Nassau County Police because they started up an ambulance service back in the 70s, and you can Google that, when they started up. I wanted to get the job there because I loved the color scheme. And as soon as the colors came up, I'd like to tell you it was a high-tech thing, but no.
That we have appropriate equipment as needed in the worst case scenario. We went through the worst case scenario last year. Hopefully we never have that again, but we want to ensure if we do, we now have more tracked vehicles. We have more availability to work with partners, including snowmobile clubs. In the snowmobile clubs, we also understand it's their tracked vehicles too. During the height of last year's blizzard, if you were on a snowmobile, you put your own life at risk because of how dangerous it was. One of our members here, I know Jerry Whittington went out in the storm at the height of it on a snowmobile and just came back and said, I've never seen anything like this. I don't want to go back out there. So you got to be careful when people say a snowmobile. There's certain things that if you're not properly dressed for, you could have died even on a snowmobile last year. But I want to ask our Commissioner of Homeland Security and Emergency Services, Dan Neverth, to talk a little bit more. But I feel we're prepared. We will start very soon the transition for our Department of Public Works from the construction part of the truck to actually putting the plows on. I think that's actually starting right now at our Concord district, just in case they start getting snow in the hills late at night. But we're prepared as we always are. We just saw something last year that we never really thought would happen, but it did, and it just means we have to act a step higher. So, Commissioner?
Thank you. First, let me congratulate Deputy Commissioner Gill, Commissioner Gail Burstein, their entire staff, having had previous experience through another organization, the attention to detail and the work that goes on. This is a nice shiny ambulance, but this is 1/100th of the story for all of the work that they've done. Thank you to the county executive and all the elected officials who, put their heads together and allowed this to happen. So I did want to mention that as well. As I have mentioned many, many times when I've been over at the legislature, not a day goes by that our department, but I'm proud to say every department under the leadership of the county executive, including the health, including social services, the deputy county executive, and external agencies are not working on taking a look at a snapshot at the blizzard and how we can tweak that and how we can make things a little bit better. So our efforts have more than tripled with regards to some of the things that are going to take place. Again, the unsexy stuff, the planning. The new equipment is great. But you need to be able to operate that equipment in an environment. And if you can't see, you can't see. It doesn't really matter what piece of equipment is that you're operating. So we have enhanced a number of different things. We've taken a look at the 858 snow number and how can we can improve that and bring people under a different umbrella. So I feel we are prepared. The question is, what's going to be the next challenge that's thrown at us? Will it completely eliminate an entire power grid for a vulnerable population? And then how do we work a little bit closer to assure that maybe that's insulated a little bit more as well? So we work every single day on it. We are ready. We don't necessarily look forward to that challenge, but it's the efforts of everybody here and the close working relationships that we have with all of our partners, regardless of your political affiliation, that when we have a storm that's approaching, we get everybody on the same page. We talk about what we're going to do. So yeah, I feel very confident. Communications is the number one factor. You then take that and you put that into service with all of the new shiny equipment that you have.
Thank you. And I'll just note, and then we'll break up for off topic off to the side. In the past couple weeks, we've had the commissioner of the Department of Public Works from the city of Buffalo and the chief of staff to the mayor in our office discussing pre-planning for the upcoming winter of what may be needed in case a very bad storm occurs. Erie County has 1,200 centerline miles of roads that it owns and controls and is responsible for maintaining and then keeping the snow off during the winter. We actually contract with the towns down in this portion of the county to help us do that. We pay them a certain amount per lane mile per year so that they can help keep those roads clear. Because we just do not have the capability in Erie County of even clearing off all 1,200 centerline miles of our roads. We are standing by as necessary to help the city of Buffalo and other municipalities, as we always do, but we can't be the one primarily responsible for their cleanup. It is incumbent upon all the communities to have that initial set of folks and equipment on the ground to do that. But we're always willing to work with them, and we've already started the planning for next year. With that, I want to thank everyone for being here. I really appreciate it. It is a great day. Lives will be saved because of the actions that were done to create this ambulance service, and it's something we can all be proud of. Thank you all, and any off topics we'll take to the side. Supervisors?